guys, in today's mind mapping series, we discuss the dental considerations in patients with renal disease. As a dentist, even if you're doing a minor dental procedure on a patient with renal disease, there are some considerations that you need to keep in mind before starting the treatment, during the treatment, and after the treatment. Before fixing the dental appointment for such a patient, you need to determine the hemodialysis schedule for this patient and then fix an appointment 12 hours post dialysis. This will ensure that there are low toxins in the blood and the effect of heparin, which is an anticoagulant, is minimal. The patient will be best able to respond to the stress of the treatment if you give it 12 hours post dialysis. Apart from this, we must encourage the patients to undergo periodic testing and evaluation for hepatitis B and C, HIV, anemia, and leukocyte count disorders. You need to identify the vascular access and type. Now, this is basically the hemodialysis access, which is never used for the injection of medication, and you should avoid taking blood pressure measurement in such patients because it's going to include the arteriovenous shunt. If the device is on the leg, which it is usually on the arm, but if it is on the leg, then you allow the patient to stand or walk occasionally during long procedures. The dental procedure should be delayed for at least 2 weeks after the placement of a vascular access, and you should avoid the treatment during periods of infection or thrombosis of the access. So this is what you need to remember about the access, that you do not inject any medication over here, you do not take any blood pressure measurement on that arm, you do not you delay the procedure for at least 2 weeks after the placement of a vascular access, and if the device is on the leg, you allow the patient to stand or walk occasionally during a long procedure. You can also give the patient some antibiotic prophylaxis to prevent infective endocarditis, vascular access infection, and bacteremia, since the patient is on a lot of immunosuppressants. During the treatment, you must remember to take the history and physical examination for the presence of oral manifestations and treat accordingly as the oral manifestations, which will be discussed in another video. We should also use adjunctive hemostatic aids during oral or periodontal surgical procedures. You should administer LA slowly, and the dose should not be more than 25% of the maximum total recommended dose for normal patients. Apart from that, we also need to maintain the patient in a comfortable uncramped position on the dental chair and allow the patient to walk or stand intermittently during long procedures. Post-treatment, we need to give post-surgical hemostatic agents and topical antifungals to prevent the control of localized oral infections. You also need to adjust the dosage of the post-operative medications according to the extent of renal failure. Now, you have two dosage categories that are usually available. One is with the patient with mild to moderate renal failure, and the other is for the patients with severe renal failure. You can prescribe sodium salts of penicillin, clindamycin, and erythromycin. You should avoid giving potassium salts of penicillin due to the potential of hyperkalemia. The other drugs that you should avoid are NSAIDs because of the nephrotoxic effect. So this is about the dental considerations in patients with renal disease, which we remembered under 3 headings, that is before treatment, during treatment, and after treatment. Before treatment, we spoke about how you should give a dental appointment 12 hours post dialysis, and you should encourage the patient to undergo a lot of tests regularly for hepatitis, HIV, anemia, and leukocyte disorders. We also spoke about 4 points that we must remember about the vascular access, which is basically the hemodialysis access, where you do not inject any medications on that arm, or you do not take blood pressure, and if the device is on the leg, then you periodically ask the patient to stand or walk, and you should delay it in case of infections of the vascular access. For antibiotic prophylaxis, we spoke about the importance of antibiotic prophylaxis for patients to prevent patients from having infective endocarditis, vascular access infections, and bacteremia. During treatment, it's very important to have your LA administration slowly, and the dosage is 25% of the maximum recommended dose. And after treatment, you need to remember the drugs that can be given, cannot be given, and the dosages of each of these drugs.